Let's discuss liver blood deficiency. The liver has a very close relationship with blood. Liver Qi helps to ensure that there is free movement of blood in the body, and it is in the liver that blood is stored. The liver constantly ensures that the correct amount of blood is circulating in the body at any given time. During physical activity, blood is sent out into the body, and when the body is resting, blood returns to the liver. At night, blood is mainly gathered in the liver, where it helps to anchor the hun. Blood, for its part, helps to nourish and moisten the liver. Therefore, it is essential that there is sufficient liver blood to keep the liver soft and flexible. Otherwise, liver qi will have a tendency to stagnate. Liver blood is an aspect of liver yin, so there will be an overlap of symptoms and signs between these two patterns, but there are also important differences. Due to menstruation and childbirth, women have a greater tendency to be liver blood deficient than men. There are three main causes of liver blood deficiency: poor production of blood, insufficient consumption of food that nourishes blood, and loss of blood through bleeding. Excessive physical training can also consume blood, meaning that blood deficiency arises. Blood loss during childbirth, heavy menstrual bleeding, bleeding disorders, operations, physical trauma, and so on can lead to liver blood deficiency. The condition can still be present a long time after the blood loss. In some cases, this can be years later. Excessive physical activity, especially in women who train hard, can lead to liver blood deficiency. This does not only affect professional sportswomen or dancers, but can also affect women who train to run marathons, triathlons, or Ironman events because the excessive training consumes blood, which is used to nourish the muscles. This is why many women who play sport, dance, and train at a high level stop menstruating. Poor production of blood will be due to weakness of the organs involved in blood production. This will be due to etiological factors that weaken the spleen and kidneys and will eventually lead to liver blood deficiency. Even if the spleen and kidneys are strong enough, liver blood deficiency can still arise if the person's diet is deficient in foods that directly nourish blood. Symptoms and signs: dizziness, especially when getting up from a seated or lying position, spots or floaters in the vision, difficulty focusing the vision, dry eyes or a sensation of grit in the eyes that water in the wind, sensitivity to bright light, poor night vision, insomnia, pale and sallow complexion, pale and dry lips, dry skin, rigid fingernails or weak and frayed fingernails, dry hair, hair loss, numbness or tingling in the limbs, weak muscles, leg cramps or restless legs, especially in the evening and at night, amenorrhea or scanty menstrual bleeding, depression, sadness or lack of vision in life, tendency to be weepy and very sensitive during the premenstrual phase, indecisiveness. The voice may lack resonance and be hesitant. The voice may lack resonance even when they are angry. Thin, pale, and dry tongue, pale or orange sides of the tongue, fine or choppy pulse. Key symptoms: dizziness, floaters in the vision, scanty menstrual bleeding, rigid or weak fingernails, and pale sides of the tongue. Treatment principle: nourish liver blood. We can choose from bladder 17, 18, 20, 21, stomach 36, spleen 6, liver 3, 8, and ren 4. Needle technique is tonifying. Moxa can be used and should be used on bladder 17. Bladder 17 nourishes blood. Liver 3, liver 8, spleen 6, and bladder 18 nourish liver blood. Spleen 6, stomach 36, bladder 20 and 21 tonify spleen qi and thereby the production of blood. Ren 4 tonifies yuan qi and thereby the production of blood. It is important that a person who is liver blood deficient eats a diet that nourishes blood. They will benefit from eating red meat, bone marrow, and blood sausages. Eating organic liver will be especially salutary because it nourishes both blood and the liver directly. Green leaf vegetables will also be beneficial because they have a high iron content and because their green color has a resonance with the liver. Other foods that nourish blood are beetroot, seaweed, dates, kidney beans, black beans, aduki beans, goji berries, angelica, and nettle tea. A person who is liver blood deficient should avoid sugar, stimulants such as coffee, and too much alcohol. The patient should eat a diet that not only directly nourishes liver blood, but also tonifies spleen qi. That is warm, prepared food that is not cold in its energy and does not produce dampness. Lying down for 20 minutes in the middle of the day is recommended as it enables blood to return to the liver. Excessive training should be discouraged. Liver blood deficiency can be caused by blood deficiency, spleen qi deficiency, spleen yang deficiency, kidney yin deficiency, and can result in spleen qi deficiency, liver qi stagnation, heart blood deficiency, liver yin deficiency, ascending liver yang, kidney jing deficiency. Let us summarize liver blood deficiency. Etiology, diet poor in nourishment or lacking in protein, damage to yin blood as a result of prolonged illness, blood loss, excessive physical work, chronic illness, too much sexual activity. Underlying accompanying pathology, stagnation of liver qi, spleen qi deficiency, kidney yin deficiency, liver yin deficiency. Signs and symptoms, dizziness, numbness, tingling of limbs, insomnia, blurred vision, visual floaters, poor night vision, light menstruation, dull pale complexion, pale lips, muscular weakness, cramps, brittle nails, dry skin, hair, depression. Pulse choppy or fine. Tongue, pale body, paler sides. Sides may be orangey. Treatment principle, nourish young, rectify blood. Acupuncture treatment. Bladder 18 nourishes liver blood. Bladder 20 fortifies spleen to generate blood. Bladder 17 with moxa nourishes blood. Liver 8 supplements liver blood. Liver 14 calms the liver. This inhibits qi. Liver 3 courses liver qi. Spleen 6 nourishes blood. Ren 4 supplements blood. We do moxa. Stomach 36 supplements blood. GB 34 nourishes the sinews. Bladder 23 enriches kidneys to generate blood. The extra point Yu Yao benefits the eyes and needle with supplementation. Thank you for listening.